My name is Registse Lewis and I'm a specialist physiotherapist here at the Royal United Hospitals in Bath, and I have specialised in the management of long-term conditions.
I'm Chrissie Entwistle and I'm a specialist medical physiotherapist, and I have specialised in providing rehab programmes and in acute respiratory care.
I think we were finding here, or the haematologists were finding, that there wasn't a whole lot of advice given to patients after a blood clot, and they didn't perhaps know exactly what to advise in detail. So consequently patients weren't told very much, and that could lead to a lot of anxiety and perhaps also some misinterpretation of symptoms. So we were very keen to provide some information to our patients to let them know that it's safe and it's beneficial to get active again after a clot.
So the patients were referred to us via our haematologists here when they were seen at a clinic 3 months after the diagnosis of a PE. But it was mainly for patients that had got very deconditioned, were quite scared to exercise, and it targeted patients that had a unprovoked PE, wasn't it, as well as patients that had a DVT as well.
Most certainly. I think we've found that it really adds to quality of life. It helps with function and general sort of mood, but that anxiety component, it does help to calm the anxiety and just get back into the swing of things.
Yeah, I think what we've seen is that patients have, like Registse mentioned, have been so anxious about how far they should push themselves with exercise, and just having someone there to say it's okay to do this and to provide that reassurance, but to also to educate them and take them through exercises which are beneficial is fantastic. So.
And I guess also the age range we've had through is quite wide. So in terms of things like returning to work, it's really helpful to have a bit of support or to get yourself a bit fitter again before you go back. I think we'd look at how they are and how this clot, be it a pulmonary embolism or a deep vein thrombosis, how that's affected them, how they're feeling. We would look to normalise what they're experiencing, because that anxiety is normal. But we would also really look to emphasise that shortness of breath is normal. It's normal for all of us. We all experience shortness of breath when we're exerting ourselves. So it's getting used to what is normal for me, and then gradually pushing that, gradually increasing what you do, accepting that there is shortness of breath as you're exerting yourself.
So when patients are referred to us, they come to us and we assess them for their suitability to exercise, and like Registse says, we take them through a very sort of medical history, and to see what their baseline is, and really to talk to them about their goals and agree what they would like to get out of seeing us and attending at the rehab program. So it's very patient focused, but they are they're exercising under supervision to start with. Yeah, absolutely. A lot of programs that we run here at the RUH, like pulmonary rehab and cardiac rehab, we tend to see patients, older patients, but we have seen younger patients in their 30s that have been really debilitated by having a PE, and then getting in that vicious cycle of anxiety and deconditioning, and we've seen them be able to improve their general exercise tolerance and to be able to return to work. So yeah, it's massive age range that we see, which is it's great.
And the improvement might be something like taking a person from not being able to walk around their own living room without quite a lot of anxiety and shortness of breath to going on a walking holiday. We have a few messages.
Yeah, we do. Yeah.
But one is a gradual approach. That's really essential. Don't think about straight away what you used to do, but think about what you've done in the past 2 weeks, and then gradually increase what you do.
Yeah, mine would be that shortness of breath is absolutely normal, and that we all get short of breath. It's just different levels of exercise that where we experience that, but it's absolutely normal to get short of breath when you exercise.
A caveat to that, which is also in the leaflet, is that good communication with the medical team is essential. If you are experiencing progressive worsening of your shortness of breath, it is not linked to exertion as such, then of course go and get medical advice. We would recommend to have a look at this leaflet here, and we are hoping that it will be given out in clinics by consultants and other members of the multidisciplinary team. In here we have given some advice and also some pointers about gradual strengthening and gradual cardiovascular exercises, getting back into things.
Yeah, and just to add that it's a really useful resource for patients, but also for health professionals as well, if they are seeking a little bit of guidance regarding exercises and PEs.